Health Options Program, or SHOP Marketplace. My name is Shumway Marshall. I'm the Digital Director here at Business Forward, and we are a Washington-based organization whose goal is to help business leaders advise Washington on how to generate jobs and accelerate the nation's economic recovery. Just as a reminder, this webinar and call is not for press purposes and off the record. Today we are joined by Brooke, the Health Insurance Specialist at the Centers for Medicare and Medicaid Services, and Kasia Witkowski, who's the External Affairs Specialist at the U.S. Office of Intergovernmental and External Affairs at the U.S. Department of Health and Human Services. There'll be time for questions at the end of the presentation, and if you do have a question, you can use your control panel on the webinar and using the chat feature. Or you can also email info@businessfwd.org. I'll put that information in the message field in a quick second. So feel free to submit your questions anytime during the presentation, and I'll read them off. But for now, let's please welcome Kasia. Thank you so much for joining us, Kasia.
Thanks, Shumway. Good afternoon, everyone. As Shumway mentioned, my name is Kasia Witkowski, and I work at the Department of Health and Human Services, and I'm in the Office of Intergovernmental and External Affairs. So our job is to work regularly with great businesses and folks like yourself to make sure we are a resource in sharing information with you all. So this is actually part of a series of monthly webinars and conference calls we do so that we can keep you abreast of all the information we're working on here at HHS. So we do want to thank you so much for participating in today's call and look forward to continuing working with you. And please feel free to give feedback to both Business Forward and ourselves on different topic areas or information that we can be better sharing with you to prepare you all. So without further ado, I will actually turn it over to my colleague Brooke Bell, who again is a health insurance specialist at CMS. Brooke?
Thanks a lot, Kasia and Shumway. It's great to be here today. Today we're looking forward to talking with you about the SHOP Marketplace, which it's exciting about the SHOP Marketplace because the individual marketplace, though open enrollment period there is closed, the SHOP Marketplace is available for small businesses year-round. We've actually just launched some new tools that help enrolling in the SHOP Marketplace easier for small businesses. So we wanted to provide you with a demonstration of those today. So we'll go ahead and get started. Just to let all of you know, the tools are available on healthcare.gov/smallbusinesses, or if you go to the healthcare.gov main screen, you just click on the Small Businesses tab here. So today we're going to start walking you through how small businesses can determine if they're eligible for the SHOP Marketplace. So this takes you to the SHOP Marketplace FTE calculator. And the SHOP Marketplace is available for small businesses between 1 and 50 full-time equivalent employees in the federally facilitated SHOP. And this tool is really created to let you know if you may be eligible to provide coverage to your employees through the SHOP Marketplace. So we'll click this green button to get started. And what's interesting about determining eligibility for the SHOP Marketplace is that it takes into consideration both full-time and part-time employees through the full-time equivalent calculator. So a small business with anyone between 1 and 50 employees can be eligible. And this tool kind of walks you through how you determine if you're eligible. So the first question here is to enter the number of full-time employees you have. And in SHOP, to determine eligibility, we're basing full-time off of a 30-hour work week. So if you have, say, 10 full-time employees that work 30 or more hours a week, you'd put the number there. This blue box gives you a little bit more information about who you would consider in this number. And if you click on this, you can determine which employees are not considered full-time employees. So when you're thinking about whether you might be eligible to offer coverage to your employees through the SHOP marketplace, you would not consider any co-owners in that number of full-time workers, any business partners or shareholders of more than 2% of an S corporation, owners of more than 5% of other businesses, or any family members. So if you are a small business owner who just owns a business with your wife or maybe another member of your family, you would not be eligible for the SHOP marketplace, but you would be eligible for coverage through the individual marketplace. And this box really just goes into more information about who to provide in this calculation. So we added the number of full-time employees who work on average of 30 or more hours per week, and next we'll enter the number of part-time employees. To make this a little bit easier for employers, we've made a worksheet button. So for example, say you know that you have 6 part-time employees. You can put the number here. And each week, you know that those employees work 20 hours. So employee A works 20 hours. Employee B, oops. And you can add the name of your employees if that helps to keep you organized. I'm just doing this to make it a little bit faster. And for this example, I'm using the same numbers just to be faster, but you could use a different number for whatever your employees work. Okay. All right. So those are all of the part-time employees and the hours worked per week. You can also add in hours by month or year if it's easier to have that information on hand. All of this information we expect employers to get from any payroll data. So this number here is the total part-time hours worked, and that's taken into consideration for purposes of determining SHOP eligibility. So once you put in all of the total numbers, you'll see here that it says that this employer under this example has 16 full-time equivalent employees. That means that under this example, the employer would be eligible for SHOP marketplace coverage because they have less than 50 employees. So if an employer is not eligible for SHOP marketplace, for example, if they have over 50 full-time equivalent employees, the response would be different and would tell the employer that they would not be eligible. So the next tool that we'd like to show you is that the SHOP tax credit estimator. So one of the other key elements of the SHOP marketplace is that it gives employers access to the small business healthcare tax credit. Again, you can find this tool located on healthcare.gov and under the Small Businesses tab. So the Small Business Healthcare Tax Credit has been available since the passage of the Affordable Care Act, but starting in 2014, the Small Business Healthcare Tax Credit is only available to employers who purchase coverage through the SHOP marketplace. And for this year, employers who enroll in SHOP marketplace coverage can do so through direct enrollment. Moving into 2015, we will have the online SHOP marketplace available where employers can enroll online. But to tell you a little bit more about the Small Business Healthcare Tax Credit, it's available for tax-exempt and non-exempt employers who provide coverage for their employees who are low to moderate wage workers. So that's that's on average workers who make $50,000 per year or less. And employers, in order to be eligible for the tax credit, must contribute up to 50% of the employee's premium cost. So once an employer chooses to go through this process and go through the calculator and decides to enroll in SHOP coverage, the tax credit is actually recouped at the end of the year when the employer files their taxes. So that makes it a little bit different than the tax credits that are available through the individual marketplace. So let's go ahead and get started and walk through the tax credit estimator. Right here it gives a little bit more information about information to have on hand when you're going through this tool. You'll want to have a good sense of the full and part-time workers, the hours worked by each employee. Any wage and tax forms are going to be helpful in putting the correct information into the tool, and an idea of either premiums paid in the past or what you intend to pay in the future. For the SHOP health plans, you can get a sense of the plans that are available through SHOP on the premium estimation tool on healthcare.gov, and that will help you to input the correct information here. So we'll go ahead and get started. And again, we will use an example that we'll just make up. And as I said earlier, this tax credit is available for exempt and non-exempt employers. But it's important to note that if you are a non-for-profit, the tax credit is a little bit different. So for for-profit employers, the tax credit is worth up to 50% of your employer contribution, which can be a lot of tax credit. But for a non-for-profit or tax-exempt employer, you would actually claim the credit as a refund. So it's a little bit different the way that it's applied to each employer type. And for this example, we will say that the tax credit is available for employers with less than 25 employees. So in the example, we'll go ahead and say that we have 10 full-time employees. And this is different, the calculation is different than what we're looking at for terms of SHOP eligibility. When we were talking about SHOP eligibility, we were looking at those employees who work on average 30 or more hours per week. For the tax credit, we're looking at 40 or more hours per week. So that's a little bit different, and it's important to note that distinction there. Again, we give a little tip sheet on who to and who not to include in the calculation when you're thinking about your full-time employees. So here we go. And these blue boxes provide additional information. And similar to looking at SHOP eligibility, we take into consideration part-time workers. And to make it easier, we have a part-time worker worksheet. And this time we'll say that we have 6 part-time workers. And we know how many hours they work per week on average. So So that shows all of the part-time hours worked by each of the part-time workers. And then you can click continue. So the total part-time hours worked is 140 per week by part-time workers. And this automatically is changed into a yearly calculation. If you see here, it says enter the part-time employee hours worked for the applicable tax year. Depending on what you choose on the worksheet, the back-end methodology is changed in the calculator for you. Okay, so going down here, again, we said that it's important for employers to have any tax or wage information on hand so that they can input the best information. So we're asking here for the total employee wages for the applicable tax year. So in this instance, we will say and in order to be eligible for the tax credit, the employer has to pay at least 50% of the employee premiums. You can say yes. And then enter the total employee premiums for the tax year. And this can include dental premiums and also dependent premiums. So it's not just based off of healthcare premiums. Say, and show results. So when an employer is eligible for the tax credit, the feedback results here will tell you the estimated amount of what the tax credit could be if the employer chooses to provide coverage through the shop marketplace, and then completes the correct forms at the end of the tax year when they're filing their taxes. So we really hope that this tool is helpful to show the value of the small business healthcare tax credit to those who may be eligible. So that completes the demonstration of the tools. I'd be happy to take any questions.
Yeah, sure. Thank you so much, Brooke. And I'm really honored to be part of your small business as a part-time employee. We have a question from Yvette. She asks if hold on one second. She has what about varying people who work varying hours, and how do you calculate that? So, for instance, for her, she has some part-time workers who work. She has five hours one week and 17 hours the next. How would you enter that into the calculator?
That's a good question. The calculators have, I'll go back here. The calculators have so if the weekly hours of employees varies, it might be easier just to calculate it on a yearly basis. So if you have a sense of the hours worked within a year, I would say that might be easier looking retroactively.
Okay, great. And then she also wanted to know when you're entering the premiums for the tax year, what if you never had insurance and this is your first application?
That's a really great question. So if you're considering the Small Business Health Options Program and the qualified health plans that are available through SHOP, you can go to the premium estimation tool, which is available on healthcare.gov, to get a sense of the health plans that are available in your area. And I'm going to take us there off the top of my head. I'm not sure what the link is. Actually, I think we'll pretend that we're from Ohio. That's where I'm from. And you can see the plans that are available. Here. So this tool is also great. It helps you to see what's in your area. We'll say that we're looking for health plans. And since I'm a Buckeye originally, I'm going to select Ohio. And I'm from Columbus, which is in Franklin County, so I'll select that. And this is similar to the tool that we just, it's a similar look and feel, but it shows you the SHOP plans that are available. And just for expediency purposes, I'll say that we have 30-year-old employee, and you can do this for, again, all of the employees that you have. But so this tool shows all of the plans that are available in Columbus, Ohio. Depending on where you're from, you'll get different information. But if you're looking to build an estimate of what your premiums through SHOP might be, this tool gives you a really good sense of what SHOP marketplace coverage could cost you for providing coverage to your employees. So if you haven't provided coverage in the past, I would encourage you to look at the plans that are available through SHOP in your area, and that will help you to provide the correct information for determining whether you may be eligible for the Small Business Healthcare Tax Credit.
Thank you. Question from William Banks. If your business is eligible to use SHOP but you've obtained a group policy elsewhere, will tax credits also apply?
That's an interesting question. Depending on where you're located this year, there were a couple of counties in Washington State and in Wisconsin that I know can access the tax credits outside of SHOP marketplace plans. Other than that, it's really tied to SHOP marketplace coverage. If you've already enrolled in a group health plan this year, I would encourage you to look at it for future years. Starting in November, we'll have the online system available for the SHOP marketplace, and you'll be able to enroll online and see what coverage options are available for your employees through SHOP.
Great. And then Rob McCall was asking, in your example, you showed that $75,000 in premiums were paid and that the employer paid the amount or the total. Secondly, how was the credit calculated based on the $75,000 in the example? Is that something you might be able to answer?
Let's see. Let's go back. Oh. Clicking the wrong one. So this is based off total employee premiums, and so you would only in this input the premiums that the employer has paid on behalf of the employees, so not what the employees contribute. I don't know if I'm answering the question correctly, but if you're looking for additional information on the methodology behind how the tax credit is calculated, I would encourage you to go to irs.gov. There's a lot of helpful fact sheets, and there's also some additional information available on healthcare.gov. If you just put the Small Business Healthcare Tax Credit into this search engine.
Great. Again, if anyone has any questions, please feel free to put them in the questions box or the chat box in your control panel. Question from Rob. He has some questions. He had some, I think, some confusion or some wanting some clarification on whether or not there's an employer mandate and for how many employees, and how does do at any time, and when does that kick in, if so? And so basically, are businesses required to provide insurance to their employees, and if so, how many employees? And then when does that mandate kick in? And how do part-timers get calculated into that as well?
That's a good question. So we're talking about the SHOP marketplace, and for employers who would be eligible for SHOP, they are not required to provide coverage. The employer shared responsibility payments apply to employers who have more than 50 employees, and that doesn't go into effect, I believe, until, well, I know there's but I'm not an IRS professional. I know that that falls under jurisdiction from the IRS, but for purposes of SHOP eligibility and those employers who would be interested in SHOP marketplace coverage, those are folks who are really just looking at providing coverage to their employees, or are choosing to do so because they are not required to.
And Shumway, this is Kasia. I might jump in, and Brooke, that was the perfect description, and she had mentioned that the IRS actually has a lot of great resources on their site, and maybe what we can do as a follow-up to this call, Shumway, if we could send you, they've put out some recent FAQs that include employer shared responsibility, so that way folks can take a deeper look at that if they're interested.
Great, yeah, definitely. We'll send that along to everyone. Another question from Yvette, do employees have a choice of plans? Before, each employer could offer a couple of plans and each employee could choose one or the other. Is that still going to be the same?
That's a great question. So for 2014, in the federally facilitated SHOP, employers can offer a single QHP or a single QDP. So that means a qualified health plan or a qualified dental plan. Going into next year, employers may be able to offer a choice of health plans between a given metal level. So there's a lot of talk about the marketplaces and how they are arranging health plans, and you know, they're trying to show their value or the coverage level based off of metal levels. So an employer who chooses to enroll in the SHOP marketplace could choose, for example, to offer their employees a choice of silver plans. And the employee could then go into the SHOP marketplace and choose which plan fits their health and needs of their family, and choose to enroll in that plan. So employee choice is something that we will be making available when we launch on our online system later this year.
And Linda was asking us too, just related to that, whether or not there was a requirement for employees to choose a specific plan, like there was a bare minimum, such as a silver plan. Maybe, yeah.
Yeah, if employee choice is offered, the employer would kind of, you know, set the parameters of what that would be. So there isn't a real requirement. I guess the requirement would be set within the employer, but the employee does have the choice to enroll or to not enroll. If an employee has coverage through a spouse or, you know, other forms of coverage, they wouldn't be required to, but they would have that offer.
And it's again, sorry to jump in real quick, and I think it's important to just identify that the plans themselves that they will pick from have all been sort of qualified for all that we believe that they need to offer within the plans. So it's less on the level of the plan, but more that all the plans that are offered meet our standards, if that makes sense.
That's a good point.
Switching gears a bit, if the employer, this is a question from David, if the employer pays more than 50% of the premium, will their tax credit increase based upon that amount?
That's a good question. We set the eligibility on 50%, and I believe it would increase based off of the amount of premiums paid. I know, you know, if that's why employers are, I guess, more apt to include, dental premiums or dependent premiums. So I would imagine that it does increase, but there is a phase out with the tax credit, and I believe it's most valuable to those employers who have around 12 employees. Kasia, you might know more than that, but there is, I know, a kind of phase out to the tax credit where there's a point where it's more valuable. And I can, as a follow-up, we can definitely provide more information on all of that to Shumway to distribute to the group.
Yeah, great. Please do. This is a question from Diane. I don't know if you'll be able to answer this yet, but have we seen any differences in the average premiums that employers are paying under this plan versus under the Affordable Care Act versus before the Affordable Care Act was implemented for small businesses?
Well, we have the plans that are available now, and we're working with issuers to prepare for the next round of plans that they will be submitting for 2015. So we'll continue to keep watching the impact on small group premiums as those new rates get filed next year.
Okay. Question from William. Can I get a tax credit for premiums paid for more than 25 employees but less than 50? A couple people have this question.
I don't believe you'd be eligible for the small business healthcare tax credit, but I think there are still tax benefits to providing group health coverage where, and again, I'm not a tax professional, but
yeah.
I believe that small businesses still do have some tax incentives to providing coverage. So again, we can send you guys back to the irs.gov for additional information on how that works.
It also sounds like this might be great fodder for another, some of these technical questions are great fodder for another call and demonstration perhaps as well. One last, I think, technical question, if you can. Are the deductibles cumulative for the employees, or is the $11,000 deductible per person? Not sure if that really applies or something that you can answer. But again, if anyone else has any questions, we can, if you have a question that was not answered, we can definitely follow up with you. Just email us at info@businessforward. I'm just going to log in right here.
And I'm still on this small businesses page of healthcare.gov, and I know there was a question about employer shared responsibility, and I'm seeing right now it's right under this information for businesses tab. So we have additional information on employer shared responsibility here. It links to additional tools and resources at IRS. So I would encourage you to visit this web page, information from IRS and the Department of Treasury.
Here's one last great question from Beverly. If owners are not eligible for the tax credits, are they able to participate in the group plan and offer a group plan?
That's a great question. So the difference there is that you would just not include the employer in the head count when you're calculating employees. It doesn't mean that employers wouldn't be, or the owners wouldn't be eligible. So any owner of a business is definitely eligible for or to enroll in SHOP coverage if they choose to offer it to their employees. If they choose to offer dependent coverage, they can, enroll their family as well. Because we're basing all of our eligibility calculations off of the number of employees. We just take the owners out of that calculation. So it doesn't change the fact that, you know, they can still enroll. We're just basing, you know, the eligibility determinations of both the SHOP eligibility and tax credit eligibility off of those employees.
Great. Well, thank you so much, Brooke, for this demonstration, and also Kasia for lending your expertise as well. And we look forward to having you on future calls and webinars. And thank you also to all the business owners and business leaders who've taken part today. We had some really great questions, and we'll be sure to plan some additional programming around this topic, because it sounds like a lot of you have some great questions. If there are any questions that you have outstanding, please email info@businessfwd.org. You could also just reply right to that email invitation that you received. And if you also have ideas for other panels or information or topics for discussion that you'd like, please feel free to let us know. There will be a survey going out, and we'll send around a recording in case you missed or needed to revisit anything. Well, again, thank you so much, everyone, for joining us today.
Great. Thanks so much, everybody.
Thank you.
Have a great day.
Thanks. We'll end it there.